Hello, my name is Kristen Fanning. I'm going to discuss a couple of papers regarding the idea of using ultrasound to check for anterior cruciate ligament injuries, commonly known as ACL tears. Today on July 13th, 2025. As we know, ACL tears are a common knee injury, typically diagnosed through MRI imaging, and patients undergo ACL reconstruction followed by physical therapy. I personally met a mother of one of my schoolmates who was in physical therapy for that reason while I was in my session following a knee injury from karate. While an MRI is a preferred approach, it's an expensive testing procedure, whereas an ultrasound isn't as much. So, Breukers et al. Had 247 patients with knee complaints undergo arthroscopy, simply a procedure that requires a small incision for a camera to go in and visualize and diagnose any issues within the joint, like torn ligaments, cartilage, or tendons. They also underwent a preoperative ultrasound to determine any ACL injuries. The ACL should move upwards during passive flexion and extension movement in a knee, but in the case of a complete torn ACL, there's no upward movement. In a partial tear, there's scar tissue and less upward movement. After the ultrasound, there is arthroscopy to confirm the ultrasound results. Kumar et al., just like Breukers' group, had patients that complained of knee problems. However, he had 130 patients undergo clinical evaluations, the ultrasound, and the MRI. Of all 247 patients through Breukers' group, 120 showed proof of ACL tears via ultrasound. 60 had partial tears. 59 had complete tears. And in one patient, the tear wasn't described or retrieved. Through arthroscopy, 108 ACL tears were found, meaning 60 were partial and 48 were complete tears, concluding that it is possible to use ultrasound to diagnose ACL tears. In Kumar's group, out of 130 patients, 91 had positive ultrasound results regarding ACL tears, while 89 of those patients had ACL tears confirmed by the MRI. Interestingly, 39 patients had negative ultrasound results, but 22 of them had an ACL tear detected by the MRI. They also concluded that without the intention of replacing the MRI, it's possible to have patients undergo an ultrasound for the first-in-line diagnosis of ACL tears before confirming it with further testing, given how deep within the knee joint it is.